Hi, Newbie Nurse Ruthie here, and today we're going to be talking about psychiatric patients. Now, who technically is a psychiatric patient? Think about it. All right, you give up. Everyone of your patients has some kind of psych issue going on. They may be stressed about this hospital bill they're having. They're missing their job. They don't know how they're going to pay their bills. No one wants to watch their children. They're angry. They're upset. They're losing control because of their health. We have the ones that actually attempt or are thinking about attempting to take their life. The number one way you treat psychiatric patients is the way you treat everyone else, with respect. You have someone at your facility that states they want to hurt themselves. At that moment on, you are the one that has to protect them as a facility. I'm pretty sure you have protocols of where you work. I work in Florida, so there is an act called a Baker Act that we use here. There is voluntary and non-voluntary. Basically, the patient can come in and say, yes, I've had thoughts about hurting myself. Or a family member could have called the police and stated, they were trying to hurt themselves, or they actually found them like with a bottle next to them, or their arms, their wrists slipped. If that's the case, then that would be involuntary. Yet, just because a person signs in voluntary doesn't mean that they could just walk out the door. The term is very deceiving and confusing, especially at a time of stress. We'll say, I signed in voluntary. So again, the number one priority for this patient is to keep them safe. I think of someone with mental health. I think of Kanye West. I did an interview one time, and I never thought about this. He said that, when he went to a psych unit, you take away everyone and everything. And then that made him feel very alone. And everyone that he felt like could help him, support him, he couldn't contact them. Not only are you taking away the support system, but you're also taking away their clothing most of the time, because at least at my facility, they come in, you take everything out of the room. Before they even walk in the room, you're supposed to take everything out of the room, anything that they can hurt themselves with. If somebody wants to hurt themselves, they're gonna find a way to do it. I remember in nursing school, we heard this story of there was a patient that had a trach, and I guess the of this patient was a Baker Act or under some kind of psychiatric hold. And I don't know the circumstances as far as why they didn't notice, but I guess the psychiatric patient had taken all of the gauze that was around the trach and actually stuffed it down his throat and suffocated himself. So, those little beautiful like peanut butter and jelly sandwiches that come in the wrapper, make sure you take the wrappers off. Type of metal such as a can, plastic bags. Also, if you have a visitor going into the room, they need to leave all their belongings in the car. They should be wanded. And also the patient, before they go into the room or when they're in the room with witnesses, they're to take off their clothing respectively. It's not like a jailhouse thing. You're not going to ask them to spread it. You just make sure that you check, because there's sometimes that patients will hide things in their socks and their clothes. You'll be surprised what you find: screwdrivers. There was also a situation at another facility that I worked at. A patient had come to a lockdown unit, and I guess at shift report, one of the nurses was like, how come this patient has all their stuff with them? How come they're wearing their regular clothes? And he's just here for anxiety. Well, the nurse walked in there and she grabbed his bags, and guess what fell out of the bag? A gun, and it was loaded. So this means everyone must follow the rules. Everyone must follow the rules, because that could have turned out very, very bad. Now, at least in the ER, you'll find that, or especially if you work in the psych unit, you'll see a lot of the same patients. Sometimes you see families of the same patients. In the chart, there will be a plan of care. Now, this may be 2-person at the bedside at all times. It may be don't negotiate. It also could be a behavioral alert where the patient may be violent. And unfortunately, the biggest predictor of someone's behavior is their past behavior. If I have a patient with a flag on their chart stating that security must be at the bedside, I will follow it. I don't care if they are peachy keen, they're so sweet. This was 5 years ago. In the chart for a reason. Because if something happens, they're going to say, well, why didn't you follow the protocol? It was in the chart. I also tell the patient, say, hey, I don't know what happened 5 years ago, but it says here we're supposed to have security, and then they'll tell you, like, I was a different person back then. I'm like, oh, sorry, I got to follow the protocol, And most of the time that puts the patient at ease, because when you come to the room with security at the door, they're like, whoa, what did I do? They can become very angry and defensive. And I just tell them, hey, this was in your chart. The most important thing is just to follow the proper intake process. If you don't know what that is, you need to look up the protocol at your facility. If you follow that, you will be golden. Usually that consists of, having the patient change into a gown, make sure all their belongings are locked up. Best thing is if they have a family member there and they agree, let that family member take the stuff. But again, you want to treat them with respect, because these patients still have rights. If you have a patient that's refusing everything, you might want to talk to case management or risk management, because they need to investigate, does this patient actually have a right? If they're not competent to make decisions, then that could be a different scenario. And then yes, you can get their blood. But if they are competent and they say no, you don't want to touch them, because that's battery. They still have rights. In the end, you just want to build trust with them, show them respect. Use nonverbal communication, even if it's just bringing them a warm blanket. They could be yelling at you, and you could just, make sure you stay at arm's length. If they're yelling at you, make sure you have backup. And as I mentioned before, stay at arm's length away. Be careful with your badge reel, because they can grab that and they can choke you with it. Your stethoscope, they can choke you with it. Always have an exit plan. You don't want to get cornered. Been tragic situations. Another facility was in the news. A doctor was in the room with a patient, and she was there. She was not there for a psych reason at all. And the doctor had her back to her, and I guess the patient had taken out a knife and stabbed her 50 times. She was pregnant. She was stuck between the door, and nobody could open the door. She was screaming. Thankfully, she survived. That's a prime example. That patient did not go in there for any psych issues. You just want to be sure that you are aware, use all your senses. You get a bad vibe, you walk out. A majority of the time, they will have what's called a sitter outside of the room. Now, this person should be trained. Here we have what's called CPI training. It stands for Crisis Prevention Intervention. If you have not taken a course on how to deal with psychiatric patients, you should not be a sitter. It is not only for your safety, it is for their safety and everyone else around you. But CPI is a great course, and unfortunately, it's kind of scary, because when you're in the class, you're like, wow, you're learning how to protect yourself. And you learn some signs, when a patient locks eyes with you, that means that they're going to pounce. It really teaches you on how things escalate, how it goes from, someone verbally to throwing things to hitting to spitting, how you could possibly prevent that. We do allow our patients to have telephones. Of course, if it's a phone with a cord, these patients should be watched, either depending on if they are on camera or if they are at the door. Usually, if the patient has tried to actually commit the act of hurting themselves, there's a person right there at the door. And if you're sitting at that door, you are not supposed to be on your phone. You're not supposed to be surfing the internet. You're supposed to be staring at this patient. Because again, if something happens and you're sitting right there, or you're supposed to be watching on the camera, whose fault is that? Now, back in the day, in psychiatric wards, I could not imagine the shit that these poor patients went through. That is why there are guidelines and laws now that you can't just sedate a patient or restrain a patient just for convenience. The only time you can restrain a patient is if they are harm to themselves or others. And you can go ahead and restrain them safely. You still need a doctor's order. Look at your protocol. I believe ours is 24 hours. I work in the ER, so it's the doctor's right there. And then you want to monitor that patient. You want to make sure that they're breathing. You want to make sure that the restraints are not on too tight. You want to make sure 2 fingers can fit under the restraint, that the restraint is tied correctly, that they're not going to suffocate. Because there have been instances where patients have died, especially if you're chemically sedating them. They're at a higher risk because you don't even know what they took before they got there. In the end, as a nurse, it is your responsibility for the life of that patient. You want to make sure that they are eating, drinking if they can. Even though they have the restraints, you have to offer the bathroom. You're going to do one limb at a time. Say, hey, are we on good terms? I'm going to go ahead and Like, let's say you have them with 4-point restraints. You can have like the left lower leg removed, then the right upper arm, and then you can do the other leg. And then you can, slowly. Restraints are not PRN. They're not for your convenience. And also, in some facilities, if you put all the bed rails up, that's considered a restraint. If you put a lot of blankets on the patient, that's considered a restraint. Anything that prohibits the patient from normal movement is considered a restraint. And it all comes down to, what if that was you? One day it might be you. Maybe it was you. You would want to be treated with respect, especially at that time, that critical time, because most of the time the patient is in crisis. Well, newbies, I hope you learned something. And speaking of mental health, next week I will not be releasing a podcast episode. I'm taking the week off. I'm going to enjoy it with my husband. If you have any suggestions, any questions, you can email me at Newbie Nurse Podcast at yahoo.com. I'm also under all the Instagram, Lemon, TikTok, all Newbie Nurse, Facebook. And as I always say, treat people how you want to be treated, because what you put into this world is what you're going to get back. Have a wonderful day, guys. The views and opinions expressed in this program are those of the speaker and do not reflect the views or position of any entities they represent. Hey newbies, if you're liking this podcast, or even if you don't, like, share, and subscribe. See you next time.
Oh, thank you.